My name is Samay, and I am an anesthetist in Newcastle Hospitals NHS Trust. Apart, at work, in anesthetics. I'm especially interested in regional anesthesia, and I teach at various conferences and various workshops in regional anesthesia. I'm also the executive council member of British Islamic Medical Association, which is a charity and which works at the grassroots to increase health awareness and promotes health. It is through this work, this involvement, that I'm doing this project about organ donation awareness, which I'll be talking about in detail today. Apart from this, I'm also a lead organizer for Leveling the Field Study Day. I'll touch upon that as well briefly at the end of the presentation, which is about disparities within the NHS. I'm also faculty in other courses, which helps in the trainees with their Viva exams organized by the A-Line, the Anesthesia Learning in the Northeast. And I have also become involved with organizing conferences. I'm part of the organizing committee members for Association of Anesthetists Conference, which is happening in Newcastle next year, and also the Difficult Airway Society Conference, which is going to happen in 2022 in Newcastle. So coming back, we'll talk about this particular project, which is about increasing organ donation in the awareness about organ donation in the baby communities. I'm going to talk about this particular project, which we did over the last year and a half, which had a good impact and was recognized by both the NHS bodies as well as the community. So it's about organ donation. We all know about organ donation and what impact it has. Apart from giving life-saving organs to at least 8 people, it can change the lives of at least 75 others through various, right from skin to intestines, etc. Now, this story, everyone has a story about how their passion about a particular topic or a subject started. Now, we live in a world where it's all about social media. Before we know, we are part of 1,000 WhatsApp groups. And for me as well, it started with this message, which landed on my phone about a year and a half ago. Now, this was the time when the government was contemplating change to the organ donation law, and there was a consultation taking place somewhere early to 2019. And this message arrived from a good friend of mine who's a healthcare professional. Now, I have been working with the organ donation teams for quite a while now, since I started anesthetics, almost 10 years. And I thought it fits perfectly with my profession, with my faith, and with my values. And this was a bit surprising to me. So I gave him a call back. We discussed a bit more. He wasn't really sure why he opted out, but he had a few reasons of his own. So this just made me think, and I thought I should look a bit more into it and see why people shy away from this or have not given it a good thought before deciding against organ donation. So I started looking at the numbers first. Now, if you look at the UK population, according to the last census, as we know, it's a white population, of which is almost about 89%. And then all other communities make up to 11% of the population. So 11% for all other ethnic minority communities, and 89% is the white population. Now, if you look at the waiting list and the deceased donor list, so this is the most recent one, about a year ago, almost 35% of those who are on the waiting list are from the ethnic minority communities. Now, this is a bit disproportionate because overall general population, it's only about 11%. Then why should we be 35% overrepresented, disproportionate on the waiting list. Now, if you look a bit more closer, this is the purely the kidney statistics. The dark blue is the white population who are uh, overrepresented in the donors list. But when we come to transplant recipients, and especially the waiting lists, in spite of just being about 11% in proportion with the general population, uh, the BAME communities are again disproportionately high. Now, what it finally entails is that a third of the people waiting for a kidney across the UK are from BAME communities. And in that particular year, 2017-18, there were 28% of all the transplants which happened, kidney transplants, were in the BAME communities. If you look at the consent and authorization rates, almost 70% of the white population consent for organ donation, whereas the numbers are much lower in the BAME communities. But who suffers at the end? If if I have an organ failure, if I need a lung transplant, I'll have to wait 2.5 years more than my white colleague. About 6 months more for kidneys, and about 44 days for urgent heart transplants. Now we know as medics, as healthcare professionals, that even like every day we wait, the prognosis, the morbidity and mortality just becomes higher. Now, for a clinician like me, it's very frustrating as well that if I have two patients, probably one of them is going to survive, two patients who are dependent on organ support. And if that is because of a color of the person or his ethnic background, that's really frustrating. And that just displays the health disparity, which is prevalent in the NHS at the moment. Now, I was looking at more like why people don't want to donate their organs. And this was a research which was done in London. And people were either unsure or not willing, a majority of the BAME communities who were part of the survey. And the reasons where they gave was maybe it was not compatible with their faith or belief, or maybe just their culture. A lot of them also said that they just don't know enough about it to take a decision. And some of them thought that, my family or friends might be upset if that happens. Those who were unsure, it was predominantly that they just didn't know enough about it. And then they also asked what would make them to become donors. A lot of them said that, just having more information would help. Some of them said that more encouragement from their own faith leaders or community leaders, or even knowing someone who's actually had an organ and benefited from it. So I started thinking more. I started connecting with more colleagues at British Islamic Medical Association, at my work, and we thought there's something we definitely need to do about it. And while we were contemplating what to do, this opportunity came up by the NHSBT, where they were giving out some funds to raise the awareness of organ donation. So we thought we should grab this opportunity and go for a pilot project. We did this pilot project here. Again, we thought how we should go about it is going with the same things according to the results of that survey. So to help a person decide whether the organ donation is right for them or not, we thought we'll have someone who has received an organ and benefited from it to share their journey. We'll give them more information. We'll ask the faith leaders or community leaders their opinions and to discuss more about it, and also share some statistics. And hopefully, all these things will make them take a better informed decision. So this pilot project was first done here in Newcastle. We had a place. We got a few people to, as I said, to talk about it, like patients, some experts, some faith leaders. Got a room full of people, some specialist talks, some patients who shared their journeys, uh, what actually the organ donation process entails. Got some faith leaders to discuss, and had an extensive question answer session. The program, which was only for about 1 or 1.5 hours, actually went much beyond, because people were just so interested and they just wanted to find out more. And the panelists were very kind to address their queries. Now, what we did was we had a pre and post event questionnaire. And what we found out was almost 83% of whom, before the start of the event, thought that the organ donation is not for them and they wouldn't want to be organ donors. After the event, a lot of those who were unsure or who thought they wouldn't want to change their mind. So there was a positive shift of almost 80% who were now willing to be organ donors. We published this data, got a few prizes, presented in a few conferences, uh, first published in lesser known journals, and then in journals like in Anesthesia Journal. When we submitted it for poster presentation, it got accepted as paper presentation, as oral presentation. And then we thought, okay, we've demonstrated a clear, good impact on this and a positive change. What we should do next. So then we started having more talks with NHSBT, and more colleagues got involved. And then I led a team which did similar events across the country. We also got involved with other faith leaders, other communities, and when I led the projects in London and in other places in Cardiff and Bristol, we got other communities involved as well. Now, a very brief thing of what this achieved. We almost reached out to about 600 people or so. And before the intervention, half of them were not sure, quarter of them were against organ donation, and only a quarter of them thought that they could be organ donors. Now, post-intervention, with just 1 or 1.5 hours of giving them the information, the authentic information, the huge amount of those who were unsure changed their mind and said that now they're convinced and they would be for organ donation. A good proportion of those who were against it as well changed their minds. So there was a clear big benefit of a very small intervention, really, and which didn't require a lot of efforts, of where we can bring about positive change. We didn't just confine to doing this big events, just other, we can't really assess how this made an impact, but we got really good feedback of when we try and challenge these misconceptions of what we're spreading on the social media. We involved with NHSBT and did some national adverts of raising awareness of organ donation, made a resource on the websites, encouraged more rigorous academic discussions, used social media extensively, and also on TV channels, which were quite popular with the BAME communities. A lot of publications have since have happened, with a lot more people getting involved. And this was just one small step we took. And at least now we have a clear idea of what direction we need to take. It's something like, as I said in the earlier part of the presentation, only about 11% is non-white population. But I think if we do some simple interventions, the health disparity can be reduced. And we just need to give people the right information and authentic information, and people will make an informed choice. I'm not just doing this solely for organ donation. I'm involved with a lot of other projects as well, such as cancer screening, teaching CPR, and about COVID and flu vaccinations and stuff. So in this age of where people earlier probably were influenced by what the experts said, what was on the television, what the expert bodies like Public Health England and stuff said. But now it's changing. What one social media influencer can change the perception of people about any particular topic, you just can't compare it to any others really. So, and it's really disproportionate that way. So I think the health bodies and stuff will have to change their approach and get involved with more grassroots organizations, give the people the right information, and then the right change will happen. If not, things like this can happen. This happened very recently in the last couple of days, really, where a very bad attempt to translate this picture into a local language was done in Urdu. And it's those who can understand Urdu Punjabi can make out how bad this translation is, and it just became a laughing stock at the end. So it's about reaching out to the right people who can get the message across and reduce this health disparities. Now, what did it have for me? Now, from a person just 1.5 years ago, where I wasn't even known to all people in my own department, I just started connecting more, reaching out more, networking, multitasking, reaching out to NHS board, NSBT at one point, and transplant teams to the other, taking some critical decisions, traveling, and then also in the whole process, leading a team of almost about 40 people who we were all involved in this project. So all from what I never thought of, all the thing about leadership and management qualities kind of just build up by itself, just following my passion about one thing. How is it translating this to work? Now I'm translating from the disparities in the community. We all know there are disparities in the NHS itself. So a non-white person has challenges right from being new to the NHS, of challenges in the workplace like bullying and harassment, increased referral to GMC, or in career progression as well, the difficulty with exams, the differential attainment, and then the massive lessons we've learned from this pandemic. So we're going to address all of these in this study day, which has within 5 days has about 250 registrations. It's going to happen on the 4th of December. It's all going to be online. So it's all about following your passion and trying to do simple things which will make a positive change. Thank you very much for giving me your time and listening to my presentation and me blabbering about a few things which I was involved in the last year or so. My take-home message for you would be for any youngsters listening to this is just to follow your passion. Find that one thing which you're interested in, and if you follow that, you can make a massive impact. Also, for any NHS, healthcare professionals or anyone else listening to this, is that small interventions can make a big change. So don't hesitate to even have, even your small ideas, your ideas which you haven't thought about much, to discuss it with people. And when you discuss it, you make that into a big change or a big impact which can happen from it. If you are from the NHS bodies, then my suggestion would be that we should learn to get more involved with grassroots organizations. Now, we all know that interventions when the disease happens is not as neither it helps the person much, or it makes sense to the economy. So preventing diseases to happen is the major thing, and increasing health awareness by getting involved with grassroots organizations like BIMA. And finally, I would say that I'm very happy to be for you to contact me on the social media, which I've already displayed on the screen, and on the Slack as well. And I'll be very happy to interact and discuss and about anything you would be. If you particularly want to be involved with these projects, you're more than welcome. or any other ideas you want to take from me, more than welcome. Thank you very much again for this opportunity, and thanks for having me. Great. Bye bye.